Good morning, everyone. I'm Megan Culp, along here with Scott Micklin.
Good morning, Megan Culp. It's great to see you.
Yeah.
Great to see everybody who's joining us. I know, as you pointed out yesterday, you can't really see through the radio, but
yeah,
we see the number and we see people are watching.
That's right.
So that's what we appreciate.
That's right. Good morning.
So thank you, everybody, for joining us. It is Thursday, May the 28th, 2020.
Jeez. Last weekend of May.
Yes, exactly. Or as you call it, what, April 45th?
No, it's May 88th.
May 88th.
Or 89th or something. Yeah,
Okay.
we're pushing into 90 days.
I gotcha.
This weekend.
I understand.
Yeah,
Boy,
90 days and 100,000 deaths.
Yes, that is a
Sobering
milestone.
It is.
Statistic,
It really
yes.
is.
So, in just 3 months, I mean, that's the other part of that number.
That's what's scary about it.
Yeah.
Yeah.
So, but here we are to share local information about
right.
COVID-19, and so we're grateful that everyone has joined us, and we do have some great guests on the show today on the program. We were talking to two doctors from Salmon Regional Medical Center, which I know you enjoy every time we get to talk to them.
Faves.
Right?
Big fan.
Talking a little bit about testing and some other topics,
Therapeutic
right?
interventions and
Right.
all sorts of things. And
Llamas.
right, the llamas made a comeback.
They
so.
did. You're very excited that the doctors were actually talking about the llamas.
I
today.
am. Well, I like to feel ahead of the curve, you know?
Right. Exactly. So
I mean, let's be clear. It wasn't my idea to use llama antibodies. I just read about it.
But it has been done, right?
It has
And
been
that's
done.
where we are. So,
Yeah,
so
it's a fun interview.
Yeah,
Yeah.
It's cool. It's coming up, everybody. And then we're also going to be joined by some folks from Presbyterian Medical Services in town, and they are doing some great work with members of our population, members of our community, of course. And if they happen to be COVID positive, there's another whole range of things they need to be worried about and helping with that population too. So we'll be talking with them about that. And so we're looking forward to that as well. We'll check on the county numbers as well.
Let's do it.
And then the state numbers and things like that from yesterday. So let me call those up briefly here.
Great. So while you're
stand
doing
by.
that,
Yeah.
you ready for a fun fact I heard?
Is it about llamas?
No.
Oh.
It's about the slow creeping return to normalcy. This is world news. This is a concert hall in Berlin has officially physically removed some seating. So they've removed 2 seats at a time.
Okay.
Which is bright.
Right.
Of them, as opposed to caution taping them off or something, because that's always a little disconcerting anytime.
Right. It is.
You see, like, walk in and you see caution tape.
Yeah.
So I think they went with the right route there.
Take some seats out.
Just take some seats out.
Okay. Very good. We do have a call.
Oh, cool.
So should we go to the call?
Sure.
Should we go to the phones?
Yeah.
Let's go to the phones this morning. And good morning. You're on KSJE.
Hi, Scott. It's Laura Ann.
Laura Ann Crawford from Presbyterian Medical Services. Good morning. Thank you for joining us.
Morning. I have Christine Carlson and Tommy Fosnot with me.
You do? Great. Wonderful. Well,
excellent.
We were expecting all of you, and so that's wonderful that you're all with us this morning. So thank you very much. As we mentioned, you all were going to be on the program, and I always like to do full disclosure to remind everyone that I'm on the board of Presbyterian Medical Services.
You're on the board for everything.
No, not quite. Not quite.
You're a board junkie.
No, really not. I'm really not. But they do great work, and I'm proud to be a board member of PMS.
Yes,
so,
as you should be.
So it's great to have all three of you on. Again, Laura Ann Crawford is joining us, the Northwest Region Director from PMS, Christine Carlson, who is the Program and Clinical Administrator for the Totah Behavioral Health Authority and Sobering Center, and Tommy Fosnot is their Director of Nursing and Health Outcomes at the Farmington Community Health Center. All three are on the phone with us this morning.
It's a pretty intimidating crowd.
How about that?
That's a rock star group.
I know, right?
Yeah,
So,
lots of director.
Yeah. Cream of the crop.
Cream of the crop.
So there you go.
So good morning, guys.
So let's start by talking a little bit about the story that got our attention, which was the use of a local motel for COVID positive patients and clients. And so, Laura Ann, can you start us off with how that came to happen?
Yeah. So several months ago, when this wonderful COVID-19 thing happened and turned everybody's world upside down, my concern went immediately to our homeless population and how are we going to deal with positive homeless individuals, wanting to make sure that the services that we provide on the TOTA campus, TOTA's, JIP, and our Sobering Center, how did we keep those individuals safe and keep our services open so we can continue to provide care? So I reached out to Chief Burke, and we started conversations very, very early on and identified that, yes, that was a need to be able to provide shelter and health care to those individuals that were either at really high risk or that turned positive for COVID. So through a lot of collaboration and lots of teamwork, Chief and I kind of developed this program that now we've pulled in Department of Health. We're very happy to have Department of Health on board because, as you know, it takes a village to kind of do anything in this town and in this time. So that's kind of the history of it and where it came from. And Rimrock was generous enough to really step up and want to help us take care of these individuals. So if a homeless person turns positive, we're able to get them into the Rimrock and take care of them.
So a couple of follow-up questions. I'm impressed by the speed with which you guys acted upon this. What was the time lapse between I'm concerned about our population to this is a full-blown plan? And then a second question is, do these individuals, are they getting tested because they go into the ER with symptoms, or how are we testing homeless individuals?
So that's a great question. So the first one of how long it took, like I said, we originally started talking about it in kind of mid to end March, and we had our first client in the Rimrock, 2 or 3 weeks ago, Tommy?
May 10th.
May 10th, Tommy said. So it didn't take as long as a lot of projects do, but definitely we did take our time to make sure we were doing everything right and that we had everybody on board that needed to be on board. And they're coming. The second part of that question: how are they basically getting there once they've tested? So it's a few different ways. We have some referral sources in the community. Obviously, San Juan Regional is one, the Sobering Center is another, and really any entity that takes care of our homeless population. So for the most part, they are coming out of the hospital with a positive test. We also have had the ARU, I'm not sure if you're familiar with that, that's the Alternative Response Unit that transports intoxicated people to the Sobering Center or to the emergency room, whichever is appropriate. So Department of Health actually trained some of the ARU staff to test essentially our population. So they have actually gone to where these individuals are, wherever it is they're living or sleeping at the time, and they've tested them there. They've tested them at the Sobering Center, and then they can take them over to Rimrock from there.
Understood. And let me ask you, too, I know Rimrock is working in the Farmington area, right? But I think other places are being set up for other communities as well in our area. I think Aztec maybe has identified a location and things along that line. Is this more of a community-wide thing?
So, yeah, there's a few different locations depending on your status, like are you positive, are you recovering, and maybe your job. So like the first responders in our community are staying at a hotel in Aztec, as well as some other healthcare workers are also able to stay out there. So there are a few different, I think there's 3 hotels total in San Juan County right now that are taking care of either positive or quarantined individuals.
Very good. Thank you, Laura Ann. Appreciate it very much.
So I have a question for Christine, as program and clinical administrator at Total, the Sobering Center. Have you seen an uptick in substance use, or are we seeing just the average of what you guys usually see?
Yeah, so it's interesting. I think overall we're seeing an increase in use, but not necessarily an increase in people seeking services. So we have a lot of people who are drinking at home or drinking on the streets. We're not necessarily seeing as many people coming in for services, which is unfortunate because currently most of our services are available even over the phone. So if you wanted, say, outpatient counseling, you could do that entirely telephonically. But it is unfortunately an inadequate coping skill that people are utilizing right now.
Thank you, Christine. Very interesting. And I know for maybe some of these folks in that program, in your program, maybe they don't have a lot of family and other resources to fall back on, so they really are in need of sometimes a lot of other services that you can help provide?
Yeah, we're able to do quite a bit. We're able to actually do case management type services over the phone. We still have our traditional and faith-based services. We have our regular individual therapy. We're actually able to do group with Zoom. So one of the jokes right now is that we've all become experts on learning to utilize media in very different ways. Often with some faux pas, but it's been quite fun and challenging for us.
Well, we're glad you guys' phone skills are on point today, so thank you.
Still learning how to mute the mics, but aren't we all?
We are here, that's for sure. Yeah. That's very true. Tommy Fosnot, let me bring you into the conversation, too, a little bit about your job at the Farmington Community Health Center as Director of Nursing and Health Outcomes. What are you seeing these days in your job at the health center?
Morning, guys. So our health center, we're doing great. We're still staying busy. We have been able to kind of change the way healthcare is being given out to San Juan County at this point. We've been switching the majority of our appointments over the telephone and over a program similar to Zoom, where our providers are actually able to see the patient over the computer or talk to the patient over the phone to limit the amount of people coming in through our doors, limiting exposure at this point. It's turned great with Rimrock because we can keep in touch with our patients there over the phone, so they're still getting the care that they need, but we're like I said, limiting exposure with that. We've also changed how we're operating our pharmacy. If anyone doesn't know, we do have a full pharmacy with Presbyterian Medical Services. We've opened up several drive-up lanes where people can call our pharmacy and have the medication just delivered right out to their vehicle. No contact services. So we've been real flexible in figuring out how to keep San Juan County safe and to continue offering services to all of our patients out there.
Wonderful. Well, thank you, all three of you, for coming on the program with us this morning to share this great story about community involvement and cooperation and meeting the needs of some of our most vulnerable members in our community. We appreciate it very much.
Well, thanks for having us.
Thank you.
You're very welcome. Thank you so much. Our guests this morning on our COVID-19 local information program from Presbyterian Medical Services, again, Laura Ann Crawford, Christine Carlson, and Tommy Fosnot from PMS. Great story.
Great story,
Right. Yeah.
quality people, and so it's not surprising to me that the first thought was that population. And
Right.
it's great.
Well, we need to take care of everybody.
We do need to take care of everybody.
And not everybody has the resources to help themselves.
A lot of people don't have the resources.
In some cases.
That's right.
So it's great that they are stepping up. So great to have them on the show.
Great job, guys.
Yeah, we like it. So,
We do like
it. Let me, again, we were going to show the numbers.
The county numbers.
And so let me look for that right now. Everybody, stand by.
Standing by.
Thank you. Because this is...
Usually this
we
is
don't
where-
have a big staff here.
No, I know.
I
This
want
is
everyone
usually
to
where I
realize
put
that,
in,
right?
like,
That this is what,
some
you know.
sorta I know
Yeah.
we don't have a guy in the back like queuing us.
No,
up.
I don't know if people realize how many people it takes to put on this show, but you're basically looking at them right now. Here we are.
Here we are.
Yeah.
So he has the complicated board job.
I've got a lot of buttons
just
over
the
here.
fill.
I got some.
I'm the
little,
color
little,
commentary.
Little keyboards
Look at
to
that
play
thing,
with.
I
Yeah,
know.
exactly. So
it looks like the original like bigger phones.
right.
It had the full keyboard.
That's true,
Remember
but
that?
it's just
Swiveled them
a
out.
keyboard. Yeah, but that's all I have anyway. But I've got like 3 of them over here.
Good thing aren't you like a recreational gamer?
I should be. Should be. Anyway, here we are.
Okay.
Here are the numbers from the state health department yesterday. So again, we had 127 new cases around our state. 7,252 now. San Juan County had 37 more. It's been right around 25, 26 last couple of days. And again, that led the state in counties with the number of new cases. Again, that can mean more testing. We're finding more positives and things like that.
That's
So I
right.
don't want to read anything more into it, but that's the number. 4 other deaths in our state. One of those was in San Juan County, so now we have 104. And the recoveries were up by 74 yesterday as well, which is
Great.
good to see.
That is good to see.
We appreciate seeing that as well. So again, if you go to ksje.com and look at our news section, we have a special section dedicated to COVID-19 news and information. The daily statistics are there. We had the updated numbers just a moment ago from the Navajo Nation that came in around 10:30 last night. They had 102 new cases yesterday, 1 additional death, but they're closing on 5,000 cases on the reservation, just the reservation. So, and they break those down, again, they started breaking those down again by service areas, so you can kind of look at Shiprock and Crown Point and Kayenta, and if you can see that image on the screen right now, that dark red area is the Kayenta service area on the reservation. That's where their hotspot is of all cases. So we can share that. So there you go. So that's those.
There are the numbers.
That they are, and we want to look at the San Juan County numbers too. So let me pull those
Right.
up.
These are the exciting graph weekly average.
Yes.
Yes. So, which we show on Thursday because they're released on Wednesday evening.
Correct.
Right.
So let me find those real quick. Those are not ready,
Good.
but yeah, we'll get them. So there we go. Let's see. As we look for that.
I am hearing.
Thank you for your patience, everybody.
Yes, I am hearing some interesting stuff regarding school, like fall openings. Just again, like national news. Some states have decided to do an interesting like opt-in, opt-out. So if a parent is concerned about sending their student to school in the fall in person, they can opt into online learning, but there's also the in-person option, which sounds like a pretty heavy burden on educators, but it's kind of a creative solution.
Right. I agree.
I would definitely choose to send my child in.
Sure. Well, you've had to deal with that last month or so. The
More
last
than a month.
80 days of May.
It was well, I'll tell you what happened. It was it felt like a sleight of hand. It was like, welcome to spring break. Figure out what to do for a week, and then it was like, never mind.
Figure it out for the next 3 months.
For the next 3 months.
Yeah, I understand. Well, in talking to the superintendents on the 8 o'clock show here
Yeah.
on KSJE, I hope folks have been watching. Dr. Kim Mizell from Bloomfield Schools, Dr. Carpenter, Mr. Carpenter from Aztec Schools, and Dr. Schmidt from Farmington Schools have been talking about they are setting up, I think Dr. Mizell had 5 different scenarios that they were putting together for the fall
Yep.
as to what would be allowed or what they could do
Yeah.
or what they need to do. So in similar things to what you described.
Yeah, which makes sense to me. I mean, that's the wise thing to do.
Right.
So
And I imagine we'll be hearing more from the state, and they will be too, and taking direction from the state public education department.
I would love to be in those rooms
Would you?
at the
fly
state-
on the wall?
at the state level, not
Yeah?
a fly on the wall. An
Oh,
active,
just be in
an active
a
engagement.
person in a chair?
That's right.
Okay.
Yeah, maybe get some pizza for everybody. And let's like hash out the possibilities.
There you go.
So
Okay.
if anybody's watching,
Call Megan. There you go. Okay. There you are.
Cool.
Numbers are ready. Thanks for your patience, everyone. So these, again, are the 7-day averages, the COVID cases for the Navajo Nation, San Juan County, and the state of New Mexico. So on our screen, again, some of these data points are no longer being shared by the Navajo Nation, according to the county. And so that's why should be 4 lines, but there's only 3.
got it.
On that
Right.
graph. But the dark blue is San Juan County COVID-19 cases, and as you can see, the numbers are still
Continuing
low,
to plummet.
which we like. And Navajo Nation cases are down, the state of New Mexico cases are down, and again, that is that 7-day average, so it kind of takes out some of the peaks and valleys of looking at daily numbers, and so that's kind of why we like these graphs, and we appreciate the county, because those are the daily numbers, and that's what that looks like. So certainly a lot more ups and downs.
Yeah.
But overall, that dark blue line again is the San Juan County line, and you can see that those numbers are maybe not peaking and valleying so drastically.
That's right. Yeah, this one looks like a really erratic, like, heart monitor.
Right. Yeah, which it's not.
No, but
Just to be
again,
clear.
narrating for the listeners.
Yes,
who
thank
are
you.
not the viewers.
Who are not seeing
I'm
what
giving-
we're seeing.
That's
I
right.
appreciate
so I'm
it.
giving you a visual.
Thank you
Okay.
for that. These are the 7-day averages, again, of the San Juan County COVID-19 cases and deaths in San Juan County. So again, we can see where those numbers are going. The numbers of deaths are decreasing. Good thing.
Great thing.
On average, and the number of cases are decreasing. So again, that's that flattening of the curve that we've been talking about.
That's right.
So there you are. And the final number is the daily interpretation of that data as well. So the number of cases, again, ups and downs, and the number of deaths, kind of ups and downs. But as we can see, since May 17th, we've had a lot of single deaths. Maybe the peak was 5, but a lot of 1s and 2s. So that's improving.
That is improving.
So that's good news. So
Cool.
there you go. All right. Our next event is our guests from the hospital, right?
That's right.
Our next folks that we want
That's
to
where
talk
we
to.
do a costume change.
We do, and I'm going to leave the graphic up here so I can find the file for our next interview. We talked to these folks just yesterday, so it's a pretty recent
Fresh news.
interview
Yes.
with our.
I didn't hear any mega, crazy, shocking news last night, so should be still pretty up to date.
Oh, very up to date.
Yes.
And it's all about llamas, and they're always up to date. Here we go.
Why do they spit?
I don't know. Joining us now to talk a little bit about the recent developments from San Juan Regional Medical Center, two of our favorite doctors, friends of the show. I'm going to call them friends of the show.
Yeah,
Dr. Aaron
definitely
Philpott,
are.
Dr. Brian Greenberg from San Juan Regional. Good morning, both of you.
Good morning.
Thank you both for joining us again this week. We appreciate you taking some time out of your very busy schedules. And I know Megan has been waiting to ask this question since we last spoke to you.
Yeah.
Days.
Days. Weeks, maybe. So, Dr. Philpott, we've talked a lot about different therapeutic interventions and medicines and what is happening, what is working, what is maybe not working. And the llamas have been in the news the past few weeks. And I was made fun of weeks ago about bringing up this llama.
I don't believe I ever. You're looking at me?
I
don't think I made fun of you.
I don't remember if it was you or the listeners. But anyway.
I may have just called it into question.
So you called it into question, and now look who we have on the line. Dr.
Yes.
Philpott, can you speak to the llama?
Yeah, I think this is a fun and interesting area that could really help us in the fight, if you will, against coronavirus. So apparently there's this llama named Winter who lives in Belgium, and they have been studying llamas because they have a little bit of a unique aspect to their immune system that makes them distinctive from humans. So in humans, our antibodies are made of heavy and light chains, and they're shaped like a Y, and the heavy chains are kind of the two, if you will, the main stem of the Y, and then the two branches of it, and then the light chains are just along the branches touching the heavy chain there. Llamas have this other, they have, similar to humans, antibodies shaped like a Y with the heavy and light chains, but they also have what's called a nanobody, and it's a little tiny antibody that allows it to get in and find very small epitopes or antigens that are found in the blood. And they actually started studying this a few years back in Belgium, and they're now working together with some researchers at the University of Texas in Austin, and I believe affiliation with Dartmouth as well, looking at how these nanobodies might be beneficial in treatment of COVID-19. So they looked at MERS and the original SARS-CoV-1, and they challenged the llama, meaning they introduced the virus, the MERS and SARS-CoV-1 to the llama, and then were able to identify the viruses. And which are on the coronavirus, they can get in and bind those. And the reason this is important is because the spike protein is important for the virus to fuse or bind to the human cell and enter it and replicate. So these nanobodies bind up this spike protein before they enter the cell. So it's very interesting, emerging field of research, and I think quite endearing with this little llama Winter that's chocolate covered and has long, whimsical eyelashes. And I think as far as how we'll use it is yet to be determined, but I think some of the ideas are, could this be something that you inject, like an antibody that you either inhale or you inject to help prevent SARS-CoV-2 from even starting, or whether it be in healthcare workers or essential workers. So a lot to be seen yet on this front, but a pretty interesting story.
Definitely. That was like Nerdvana. I was all into the science going on there.
Megan was on your every word, Dr. Phil.
Well, I just want to know if like 2020 is going to be like the year of vaping llama antibodies. But
that's a leap.
Well, she said maybe inhale, maybe inject. Anyway, thank you for that. I just kind of threw out the llama, but that's a lot. It's a lot more thorough.
Yeah.
That explanation.
No.
One of the things that's actually really interesting about this is that this is not the first time that we use animal antibodies in medicine. I mean, we actually use antibodies in the context of research, but also we make antivenoms with antibodies. Things for snake bites, spider bites, jellyfish stings, etc. And we use a whole series of different antibodies and made from animals that include sheep, goats, dogs, and horses. So, you bit by a rattlesnake, and 15 years ago you had horse antibody, and now you have sheep antibody. But we basically rely on a lot of these antibodies for some of the more, I would say, revolutionary therapies for things that would otherwise be potentially life-threatening problems. But the use now in this context is really fascinating. So I hope Winter, that llama, pulls it off.
Indeed, that's true, and it's fascinating to me, both of you, that I think we sometimes forget how much animals have helped in medical research for a lot of these things that we now take for granted for some of the vaccines and other things that we do that keep us healthy, and so I think that's worth pointing out. That
is worth pointing out. And also, but there's that whole dynamic of, aren't a lot of diseases partially like zoological?
Zoological?
Yes, zoological.
Okay.
Yes. Thank you.
Perhaps?
Yeah, perhaps. I don't know.
I don't know. Anyway, doctors, thank you. That's fascinating. So there.
Yeah. I mean, there are diseases. So that word I think you're looking for is zoonotic.
Thank you.
There you
go. That's why you're the doctor.
That's true.
So there are diseases that can basically cross from animals to humans, but there are also diseases that exist only in animals as well. And the prevailing theory right now about the origin of COVID-19 is that it is indeed a zoonotic infection, and meaning that it came from an animal. Either they're not sure if it's a bat. I think the prevailing theory now is it's a bat virus, which may or may not have had an intermediate host in an animal called the pangolin, which is a fascinating animal. It's like a rolling armadillo. So I think that those kinds of infections are also very well described in medical literature. Even some of the more the viruses that make headlines, like Ebola, and even HIV is thought to have where as very beginnings perhaps a zoonotic origin.
Yeah, that's all. It's very fascinating. And Scott, I don't know if you've seen a picture of a pangolin.
Oh, yes.
They're nasty looking creatures.
I don't want to mess with
Not surprising.
Right.
That's all I'm saying. Anyway, so switching gears a bit to, we're moving into the summer months, and part of the reason we like to have you guys on is not just for these continual updates on how this stuff is evolving, but also because people, unfortunately, a lot of people's primary news source is social media, regardless of who is posting what, and which is frustrating, can be frustrating, but
Yeah.
we see currently a lot of stuff about, of course, the virus has been compared to the Spanish influenza since sort of day one, and people are now posting these graphs that talks about like, oh, here's the first wave, this is where we're at, oh, but look at this like second wave, and we've heard you guys talk about the fall as well, but it's clearly not the same virus, and so I'd be interested in hearing you guys' opinion on that.
Do you want to start, Dr. Greenberg?
Feel free, Dr. Philpott. A lot to say about this.
I think this is just a really hard question because we don't know. There's theories that are kind of pushing in both ways. I think there's a few different options as far as how things might unfold with this. Of course, ideally, this becomes kind of a smoldering burnout where the summer months heat up, those droplet particles fall to the ground more readily. People are not near each other as much, although with social distancing, we've really interrupted that cycle. And maybe we'll get some great research that demonstrates we've already had some more widespread infection than initially thought or anticipated. I think that is the best case scenario, and I hope for that often. But I think the reality is it could very well be like the 1918 Spanish flu pandemic, where they did have a very large second wave that killed a lot of the younger people. And that is certainly a concern, I think, across the country, and even a concern as far as a second wave reemerging as we open up again and kind of get back to somewhat of our normal lives and paths. I think, we can do things to change the course, and with science as it is now compared to 1918, we have so much, and there are so many people around the world working on this, and we've talked about before, but there's just a whole list of new studies nearly every day looking at transmission and exactly how to prevent transmission. So I think we're much more sophisticated, and I think if we come together and really work together as a society and do the things that the scientists are telling us, then I think we do have a fighting chance of reducing the mortality. And something we talk about often is managing this in a way to develop herd immunity over time, to minimize death as much as possible. So not to ever get us to the point where there's so many ill people that the hospital becomes overwhelmed, because that's the situation where people will die in vain if we run out of resources. So I think it's a hard question because there's no way to predict the future. There's a lot of science pushing things different ways for many different possibilities, but I think there's still a lot that we can be empowered by and do kind of going forward to help it not be the second wave of what we saw many years ago with the pandemic flu.
Great.
I think that one of the things that's actually fascinating with this is that pandemics, most of the pandemics that we just study, and most of the ones that we talk about are related to influenza and novel forms of influenza. And but pandemics in general do tend to come in waves. Successive waves are things that we really I think are likely to expect, and I think that things tend to peak with a specific wave with a certain response framework involved in trying to increase social distancing and do all kinds of large, broad-based community efforts to try to minimize transmission. But it's quite likely that we'll see more. It's unlikely that it's going to recede and disappear forever. The WHO, and this is always worth looking at a little bit on the internet, but the World Health Organization has a whole series of different pandemic phases, and most of them are front-loaded about the identification of the pandemic. But then once you're in one, it really is, you recognize that you're in a pandemic, and that you can have a peak. You try to define the peak and understand when you've reached it, and then follow it with ongoing surveillance and all those measures that Dr. Philpott's talking about to basically see whether or not you're entering a new pandemic wave that would then necessitate revisiting all of these different restrictions that were relaxed as the impact to populations tends to recede. So, but I think that most of these viruses, they're around. I mean, if you think about it, like we have a wave of influenza every year. But there is low levels of influenza throughout the population, no matter what season it is. So hopefully during the summertime, we benefit from the heat and the humidity, and at least the humidity, it helps viruses, but not in our region. There's not too much humidity here, but those things will impact the viruses and minimize their overall transmission. But I think that COVID-19, we've also seen that in the southern hemisphere where it's much warmer, they're having ongoing challenges with this as well. Even with places that have high heat and humidity, especially those folks in Brazil, they're having a tough time right now. So we can't rely on the environment to do it for us. We have to continue doing social distancing, continue to remain vigilant, embrace the new public health infrastructure, which is going to evolve in the coming months, and then be ready to roll back any sort of this advancement, as we're all trying to open everything up, and I think that's great, but we need to be ready and vigilant in case we have a resurgence of the virus and we have to all band together again to try to minimize its impact.
Yeah, that makes sense. And of course, we have plenty of diseases that never fully go away. That's what vaccines are for, right? So speaking of opening up and rolling sort of back into society, what kinds of activities, we can assume that there are activities that are higher risk than others. And so I think it'd be really interesting to hear both of your opinions on what are the safer activities to do, even if, say, we are allowed to open up to 50% capacity at a restaurant. That seems to me that would be more high risk than a hike out in the woods with two people.
Doctors?
Yeah, there's been a number of different studies and different ideas on this. A lot of different experts inputting sort of their field of expertise on like aerosols and how they travel, and with people talking, but with people running, and what's looking to be high risk and what isn't. I think kind of the underlying principles are thinking about what makes you, like speaking loudly or singing. There was in Washington, the choir group who all became infected from a single person singing together. So definitely high risk yelling or singing. As far as exercising outside, I think overall it's looking like, so two things to that. I think when you're breathing, running, biking, kind of working hard, you're going to project more aerosols. Or spitting or, whatever. So it's important to, I think, distance yourself even more than you might on average. I've seen anywhere from 15 to 18 feet be required. And then the way the aerosols flow is kind of, they swirl around behind you. So running in a line is not ideal. As far as things out in the community, like getting your hair cut, that actually is looking like a fairly high-risk behavior, and I think it's just prolonged close contact. The hair cutter, who's probably seen multiple people, is near your face and you're near their face. So I think just kind of thinking about the proximity and how you're projecting your voice or your spit or your aerosols are kind of the most important pieces, and how long you are in close contact with someone. Do you have anything to add to that, Dr. Greenberg?
Sure. Outside's better. Go for a walk. Go for a run. Don't run really close to someone. Go for a bike. Don't bike right next to someone or right behind someone. Go outside and there's plenty of activities you can do. Gardening, playing outside. I think that if you're going to go spend time with others, please consider some of the principles of social distancing, which include like wearing a mask and staying 6 feet apart. And because I think that even we found, and we have anecdotal cases of folks who just eat lunch from one another, and someone is asymptomatic and they end up transmitting the virus. So relatively, it seems like things that are relatively innocuous actually do communicate virus. The singing case is particularly telling. But I think that go outside, go be active, go do some, go and enjoy the outdoors if at all possible, and then try for those things where I think that many restaurants have been given the go in certain areas. I know in Colorado, I think starting today with specific capacity restrictions, and people can't be, I think, at bars, and the staff has to wait. The wait staff has to wear masks and whatnot. So there are ongoing restrictions, and things aren't going to look exactly like they did before. But I think everyone wants to get out there, and I think the key here is to not necessarily. How should I put this? It's not about trying to get back how everything was before, because it's going to look different. This is about doing the best we can and embracing the new normal, and embracing being conscientious for those around you, those both who are employed in these places we're going to try to patronize, as well as all the friends and neighbors that are going to be sharing the space with us. And so I would implore, as everyone gets out there, be patient and be kind to everyone else that's out there with you, and let's try to have a really great experience, even though it's not exactly how it used to be. Let's think positive about how we're all going to emerge from this together into a world which is much more conscientious about each and both the public health and each of our individual health as we try to move forward with all these unknowns. So go outside and be kind.
Good advice.
Yeah.
Good advice, doctors.
New state motto.
Exactly. And I wanted to ask, too, a little bit about, I think the idea, the underlying theme I hear from both of you is to, we can be smart about some of this stuff as we do move to reopen some parts of our economy and let other small businesses reopen and things like that, and to do it safely with what we've learned so far about how this virus moves around and infects and those types of things, as Dr. Philpott was mentioning. And so I think that's important things to talk about. I did want to point out to both of you a little milestone that the hospital announced, I think just this week, was the recoveries from San Juan Regional Medical Center, and I believe it was over 100. It's now 120 that I'm familiar with. Dr. Greenberg, Dr. Philpott, is that an accurate number about the number of patients that have come to the hospital with COVID-19 and recovered and been discharged, right?
That's
we
right.
Have had, we've had, to date, we've had 256 inpatients in our facility.
Okay.
And we've had, so we've had we still have a fair number of folks that are in the hospital, and lots of very hardworking folks in the hospital taking care of these people, and some of them are pretty ill, and we still have a pretty full COVID intensive care unit. So, I think that's one thing that I hope people out there understand, that their healthcare system is really working hard for them. But even though it may feel like, or we may all want this to be quote unquote over, it's not over, and it's still presenting a significant challenge to all the folks that are working so hard here at San Juan Regional Medical Center. We've discharged, I think, folks go to nursing homes and to home, but I think the folks that have gone directly home were almost up to 150 folks that have gone home, and so we still have 35 patients in the hospital right now.
Okay.
So, and a bunch more went to alternative care sites and to nursing homes and whatnot. So the hospital's been hard at work, and we still see lots of folks, but we're crossing some of these milestones, and we're happy to do everything we can to help the citizens in the Four Corners.
Certainly. Well, I know, and every case is different. We talked to a survivor last week on the program who mentioned, I think he was 6 weeks with medical.
He was a younger guy.
Conditions, and so we understand that, folks, it affects everybody differently, and that's something to be aware of. So very good. Well, doctors, we again appreciate your time and being with us. Dr. Greenberg, Dr. Philpott, thank you so much.
Thank you all.
Thank you all.
Thank you both very much. Our guests here on KSJE. And we're back here in the studio. Megan Cullip and Scott Micklin.
That's right, live from Studio A.
Here we are. That's right. And so we appreciate the doctors. Again, always appreciate their insights and information. And again, confirming your llama theory.
Well, was it again? I didn't start the theory and like pitch it to the University of America.
The Cullip theory of llama.
Yeah. Dear Dartmouth, I have a theory.
Yes.
Yeah.
But
I've been known to send crazy emails like that in the middle of the night, and nobody's surprised about that.
okay. But not this time.
Not this time.
All right. Very good. But I think it is interesting to hear about how animals and science working together to answer some of these questions. Well,
I just had this image of like animals like donning
in lab
white
coats.
coats.
Okay,
Yeah.
no, but thanks.
Animals and science coming together.
Working together. Well, because we have a lot of unknowns about this virus, and so
Right.
as we try to figure out a vaccine or a treatment or something, again, because the more we know about it, and the more we're able to maybe get back to some normal gatherings and things like that, we're still going to protect each other, and so all this stuff is working in that direction.
That's right.
Which is great.
Yes, that's right. So we're making some headway.
Indeed.
I've been thinking a lot about how connotations of words are changing right now. Side note.
Okay.
Like novel. I was just thinking, there's a lot that we don't know about this virus, and it's like, yeah, because it's novel. And then I'm like, oh, novel's never going to sound the same way again.
No, that's true.
And it is usually such a, good connotation behind that term, but
Right.
now it's scary.
A little different these
Anyway.
days. That's true. Well, anyway. We are...
More things to lament.
Again, that's true. On this, the 300th day of
88th
May. Yeah.
of March.
Yeah. So that's where we are.
Happy May. I hope it was a good one.
That's right.
It's closing down this week.
We are shutting it down, everybody.
Shutting down May.
And the show as well.
Yep.
So we will be back on Monday.
Monday.
9 o'clock. Live on Facebook and YouTube, everyone. Again, rebroadcast at noon on KNMI, Vertical Radio, 88.9. Again, we thank them for that. And every afternoon at KSJE, 90.9 and 103.3 FM. And you can hear the program there as well. Please share the word, and we'll be back on Monday.
See you then.
Have a safe weekend. Bye-bye.